Hi, I wanted to tell you a little bit about gastroesophageal reflux disease, which is commonly known as heartburn. This is a condition where the acidic fluid in the stomach refluxes up the esophagus, and sometimes other contents from the stomach, including food, can regurgitate up the esophagus. Common symptoms include heartburn, such as burning in the chest. People can regurgitate fluid or even cause nausea, vomiting. Sometimes it can cause a hoarseness or a sore throat because of continuous acidic fluid coming up to the throat. And even it could cause aspiration into the lungs and cause exacerbations of asthma or cough. The acidic fluid can injure the esophagus and cause the esophagus not to function as well. So sometimes it can cause patients to feel like their food isn't being pushed down appropriately and it feels like it's getting stuck. It could also lead to complications such as ulceration of the esophagus, inflammation and esophagitis. It can cause stricturing or scarring and tightening of the esophagus, and it can sometimes lead to esophageal cancer. The first line of treatment for gastroesophageal reflux disease is for patients to make lifestyle modifications, such as avoiding trigger foods. Some common trigger foods including spicy foods, acidic foods, citrus, caffeine such as coffee, chocolate, alcohol. These are all triggers, so they avoid those things. If a patient's overweight, sometimes the heavier you get, the more likely to have gastroesophageal reflux because of a pressure differential. So losing weight can help. Sometimes they will prop themselves up on pillows at night or on a wedge of their bed just so that the acid doesn't flow up their esophagus while they're laying flat at night. So these are some lifestyle changes that can help limit acid reflux. Patients then usually move on to taking medications which will deacidify the fluid in the stomach, including Tums or H2 blockers such as Pepcid, or a category called proton pump inhibitors such as omeprazole, lansoprazole. Commonly brand names are Nexium, Prilosec, etc. I've seen patients who have been suffering for a long time. They may be going to see a gastroenterologist and have had various upper endoscopies to evaluate their esophagus to make sure they're not developing any esophageal cancer. They may be having medication changes. If they've developed strictures, sometimes they actually have to have some endoscopic dilations of the stricture. But I have great news because there are surgical treatments that can really help patients who are suffering from gastroesophageal reflux. The main issue with gastroesophageal reflux is anatomic. Usually there's a dysfunction of the valve that's the end of the esophagus that helps keep acid down. And also many patients have the beginnings of or a frank hiatal hernia, which is a hole in the diaphragm that's loose, that it also contributes to letting acid come up too easily. Surgical treatments include minimally invasively repairing the hiatal hernia by tightening up the hole in the diaphragm, and also performing a procedure that will help strengthen that valve at the end of the esophagus. One procedure is the Lynx procedure, another procedure is a fundoplication. Another option for patients who suffer from GERD as well as obesity may be a gastric bypass. That can help with both of those conditions. So patients don't really need to suffer from significant gastroesophageal reflux because there are some fantastic and effective surgical treatments. In my next video, I will go into more detail about these procedures.